Hi once more, it's your girl Lovejoy, and I would like to talk to you today about prostate cancer. Cancer is basically a disease defined by the abnormal growth of cells within the body, and prostate cancer, therefore, indicates abnormality of cells within the prostate gland, which is a gland located as part of the male genital system. So prostate cancer is the most common cancer other than skin cancer that affects men. Prostate cancer can grow and spread very quickly, but for most men it is a slow progressive disease which can be obviously monitored over a period of time without any severe form of treatment. Evidence shows that prostate cancer is more prevalent among black ethnic minorities, and it is important that all men basically understand the risks and symptoms associated with prostate cancer so as to identify this in a timely manner, seek help early, and receive the right treatment at the right time. So with this said, I'm gonna tell you a bit about the signs and symptoms of prostate cancer that one needs to be aware of. The early stages of prostate cancer usually present with no symptoms, and therefore when symptoms present themselves, then that could be an advanced stage of the disease or condition requiring very urgent testing. So you will need to contact your doctor immediately if you have any of the symptoms I'm going to talk about or mention in this video, so as to get tested in a timely manner. It is also important to note that some of the symptoms of prostate cancer, which again I will get to in a bit, can be indicative of other non-cancerous urological conditions like benign prostate hypertrophy, which is an enlarged prostate. So for those people who experience symptoms of prostate cancer, they include blood in the urine or semen, urinary problems like weak urine stream, pain or burning or difficulty in passing urine, urinating frequently, especially at night, pain in the hips, pelvis, spine, or upper legs, pain or difficulty during ejaculation, and difficulty during erection. So these are some of the signs and symptoms of prostate cancer, which I've told you about. If you have any of these symptoms, or if you're worried about having any of these symptoms that I have mentioned, then it is worth having discussions with a healthcare professional or contacting your GP or your doctor to have further discussions about what this may be and may potentially going for further tests. What are some of the risk factors? What puts you at a higher risk of contracting prostate cancer? We've got age. So men aged above 65 years old have a higher risk of contracting prostate cancer. Then we've got ethnicity or race. So it's mostly common, or it's mainly common amongst black, African, and Afro-Caribbean men. Obesity is another risk factor for prostate cancer. And of course, we've got family history as well. So if you've had a member of your family, a direct member, like a father, or a sibling, had prostate cancer, then obviously that could also increase your risk of contracting the disease. Some lifestyle factors can also increase your risk of prostate cancer. As we're all aware, stress can stress can increase your risk of developing prostate cancer, as you would imagine. Stress contributes to, or stress basically affects us in so many ways, not just in terms of developing cancer, but in many other conditions as well. So it's good to live a stress-free life, okay, to minimize your risks of various diseases, including prostate cancer. Lack of exercise and diet can also contribute to our risk of prostate cancer. For example, in eating foods foods containing high fat contents can increase your risk to developing or contracting various diseases, including prostate cancer. It's very important that we watch the things that we eat, especially for the men, because I'm talking to you men, but notwithstanding, it's important for the ladies out there too, because although we don't contract prostate cancer, fatty foods or high fat food content can increase our risk of other diseases as well. So it's important to be mindful of our dietary intake. The PSA level is usually elevated in individuals or men with prostate cancer. So if you have this blood test done and comes back positive, or your levels are very raised, then obviously that could be indicative of prostate cancer, and that is again something that you would need to discuss with your doctor in terms of what to do next. A PSA level is a blood test that can be carried out in men to determine their risk of prostate cancer. What is PSA? PSA is known as prostate-specific antigen. It is a protein produced by normal or malignant or abnormal cells of the prostate gland. It is, however, important to be mindful of the fact that other benign prostate issues like BPH or benign prostate hypertrophy, as previously mentioned, can also lead to high PSA levels. So it's important not to panic should your levels be high. Just have discussions with a healthcare professional. There is no single specific testing for prostate cancer, and so various tests may be needed in order to confirm a diagnosis of prostate cancer, which obviously you and your doctor can have these, or a healthcare professional can have these discussions on what to do. So like I said, high PSA levels could be indicative of prostate cancer, could be indicative of other benign prostate diseases. So you can have that in combination with other tests. Another test that can be done to diagnose prostate cancer is a digital rectal examination, which basically is a test where your doctor will insert a gloved finger into your rectum or your back passage to feel for abnormalities or irregularities of the prostate. This examination can be very uncomfortable, but it's needed or necessary. So do not panic if you need to have that done. It's a fairly quick examination, not too long, so you just feel some discomfort for a short period of time, but obviously once it's done you should be fine. If you have raised PSA levels, or if your doctor carries out a digital rectal examination, also known as a DRE, and there's any cause for concern or there are any issues, then obviously you can be sent for an MRI scan, which is a magnetic resonance imaging scan, which obviously is a scan to check for abnormalities. And if there is any cancer, then this could, in essence, diagnose this. Now, if the MRI scan of your prostate shows any abnormalities, then you can have a further examination later, focused specifically to get a biopsy, which can be sent to the lab. So biopsy basically getting a tissue from the affected area, which is the prostate, and sending to the lab to be examined under the microscope to check for abnormalities of the cells and to confirm a diagnosis should there be any. So you can basically have a transperineal biopsy where the needle can be inserted into the prostate behind the scrotum to take a sample. The transperineal biopsy is usually done under general anesthetic, although if you do not want this and you want to have a local anesthetic, then you can have discussions with your doctor to check if this is possible. But then it can be done under general anesthetic, which means you'll be put to sleep. And of course, general anesthetic or GA comes with its own risks. So should you have to go through that, you will need to undergo a pre-assessment to assess your suitability and risk for undergoing the general anesthetic. So a transrectal biopsy can be done as well, which is basically inserting a needle through the rectum or the back passage, as you would call it, to take a sample. It can be a very uncomfortable procedure as well, and it can be done ultrasound guided. And what happens is that it can be done under local anesthetic in order to minimize the discomfort. But then again, it's important having discussions with your doctor or consultant about the way to go. Further testing can be done for advanced disease, including a CT scan and a PET scan to further diagnose the condition. So that brings us to the end of the session for today on prostate cancer. Although my specialty or background is colorectal, being a nurse, one needs to sort of be well informed with other areas of healthcare. So just a brief overview on prostate cancer, which I have shared with you. Now, if you need to research more, you can go to websites like Cancer Research UK to access further information if you need. And that's just about it for now. So until then, it's bye for now. Do not forget to comment, share, like, and subscribe if you like this video, and do watch out for more videos like this.